Good afternoon. So we have gathered here to do a case study activity about the emerging solution what we are looking for into the humanoid robot. Of course, we all know humanoid robots will assist the senior citizen peoples to do their day-to-day activities, and we have gathered here to discuss about the ethical dilemmas about this humanoid robots activities. So as third year AML students, 5 students are here to discuss about this title, and they will finally conclude about the ethical challenges, what they are facing and how we can rectify those things.
So, I am Kirtishri, and today our case study topic is ethical dilemmas of using the humanoid robots in elderly care. So these humanoid robots are nothing but the robots that can act and look like humans, and in elderly care these robots help elder people by giving them company when they feel lonely and reminding them to take their medicines and talking with them and helping them in walking. So like these, it will help and assist those elderly people just like how we do. And the big question mark is that these humanoid robots should replace the human caregivers, or it should just assist them. So we have different perspectives on it, and we'll discuss it in this case.
I'm Tamshri, and I'm playing the role of technological advocate here. I believe humanoid robots are very useful in elderly caretakers because they assist them in, if they are lonely, they assist them by changing their minds and giving some activities, and they can also provide if they can also remind elders if they are not taking medicine. They can also it can remind, and they can also make useful suggestions in elderly people, like if elder is very lonely and get out of their family, it can help like assisting them. It's not a matter, and they can make a friendly relationship with that human being, and they are helpful in this.
Covered some problems faced by the robots using to take care of elders. First thing is privacy concern. As robots use cameras, sensors and microphones to monitor the patients. Due to constant monitoring, it takes some privacy from the elders. Second one is lack of emotions, as robot may programmed to talk take care of the elders. It doesn't show real love towards the elders. Then job loss. Due to robots, many of the caretakers losing their jobs. In conclusion, robots are not completely bad. We should use as job takers cannot lose their jobs. So I would like to share the perspective of the elderly people. So as an elderly people, like when you get old, you have mixed opinions on whatever thing is happening around you. So in that case, like all the other elder people, the elder people who get assistance from the robot also have mixed opinions on the robots. They feel they feel the company of the robot, and they feel the help that the robot is assisting them with. But still, what the elder people are actually longing for is love from their children and their grandchildren. So whatever the robot is giving, it is not out of love. It is just because of it has to do that job. It has to assist them. That is all it has to do to assist them. But in this case, the elderly people, they are actually longing for true love from their kids and their grandchildren. So that cannot be given by the robots. So that is what they long for. So that care cannot be given by the robots.
Today I like to play a role of policymaker. As a policymaker, I believe robots should support humans, they should not replace them. I can conclude this by saying certain rules and we should follow it. First rule is like we should protect the privacy of elders when robots collect the data.
and make sure who is responsible when robots make a mistake, and make sure that robots should assist the humans. They should not replace them by full caregivers. And we should also make sure that robots should be assisted by everyone, not only for the rich people. By following certain rules, we can conclude that robots can be used fairly and safely in elderly care.
I say in this conclude case study, humanoid robots in elderly care have both advantages and problems. Technologies give safety, support and independence, but ethical issues like lack of human touch and job loss must be considered. Need not only physical help but also love and dignity. Thank you.